at Mende, you know. But then at the end of the day, kudos to the management of AYV for coming out with the same. Because I rightly said, a statement like that, you need someone who is grounded for it to be interpreted. You know, this country here. So these are the things we keep saying. But the management says we regret any misunderstanding or concern it may have caused. AYV remain committed to responsible journalism, including accuracy, fairness, and context in our reporting. I know heads are going to roll. But on a very serious note, though, as a Mende, as a linguist with the relevant and required qualification, and someone who studied Mende not only in secondary school but also at university, Frabe College, University of Sierra Leone, the Sierra Leonean languages, Mende, Temne, Limba, and Creole. I can tell you our editor did an awful job in translating that statement. You know, I was talking to someone, and someone asked me to interpret yesterday when the video came out, and I told the person, you know, these are one of the things where you have to pass them through, you know, other editors for interpretation. I am a linguist. I do interpretation. It's not easy. Because of one man in irrational decision, everybody's now being painted. I don't need it happen. But again, let's call a spade a spade. For someone who is not a Mende, that statement should not have been, you know, done by His Excellency the President, the number one gentleman. You know, I was talking to someone else, and 90% saying, and I don't see why they're not allow Lady Part talk so no more, and they write in speech therefore. Because some of these things, you say them, you think they don't convey meaning, but to someone who is not an N1 speaker of that language, you know, it's a problem. I saw the post of the Minister of Information, Siba, saying, for instance, there's a phrase in Creole, say, kill dog before dog, let dog no say die day. You know, I think it's a statement, or die you eye open. Yeah, that was a statement he made, die you eye open. Not mean say if or kill the person you eye open. Yes, these are idiomatic expressions. But for our local languages, that can be very tricky for translate and transcribe. Everything can be lost in a translation, but then at the end of the day, the truth is that statement should not have been made by the president. You know, it shouldn't have made the news. But yes, but enough for the maker. But anyway, we'll keep bringing you every detail that's happening currently in the country. As we know, that statement was a host of 3 statements made by His Excellency, intended to be joke, but we all know how the country they now. They say we are the second least happiest country in the world. Second least happy country in the world. We just lay behind Afghanistan. So you can understand people are not happy. Remarks like that will send shockwave around the country, around people who are concerned. You know, I applaud the editorial team and management for bringing out, you know, the statement. But then again, there has to be a statement from is it government, the Ministry of Information, the presidential spokesman. Let them make the clarification so that people will understand. Because at the end of the day, that statement was made. And I shall say then gets people when a senior linguist pass me now in a state house or within government that can make further clarification. It's not local language. I was telling someone, you know, before we came live, I was telling him series of phrases or innuendos in Mende. When you say to the ordinary Mende man, he or she will understand. But if you add few words to those, or if you say it and translate it, then it becomes a problem. Some words, for example, just by missing the tonation, you are referring to another word. I was giving an example to my colleague Ransom McLean. I said, well, you're not senior linguist. Why you know? But anyway, keep watching AYV. We have you know, exciting topics coming on this morning for you. But as always, we want to ensure that we're fair, we're credible, and as you've heard from the statements from the management and the editorial team, I think there's nothing past that. You know, is this a misunderstanding? Yes. Who edited or transcribed that, you know, without further consulting, you know, everyone down the line, you know, the digital team? Because that's what the statement says here. Initial reporting by the AYV digital team, a translation from Mandarin to English, raised the public concern, rightly so. Even me, when I see that in there, I'm like, no, the panel for don't talk this. I understand as a Mende that na joke, na innuendo, you know, but it can be, even when me translate, anyway, good morning. Good morning to our viewers and our listeners from across Ghana, Nigeria, Liberia, Guinea, the Gambia, and in country here. To all our viewers and listeners from across the country, good morning and welcome to AYV. Out of the country, in the United Kingdom, the United States, you know, Dubai and Australia, we have our viewership right there watching us. Good morning and welcome to AYV. Today is the 7th day of the 4th month in the year of our Lord 2026. My name is Bokari Matia. Continue to watch Africa Young Voices Media Empire. As we have exciting topics coming up this morning. But first, let's get a quick word from our sponsors, Local Commercial Bank, and then the others. And then when we come back, we go right into the show. I do well, eh?
In the heart of Sierra Leone's dynamic rhythm, Local Commercial Bank is your beat to a brighter financial future. We're not just a bank, but we're your financial partner to your success. We've got the financial tools you need to rise higher. Our team is here to serve you with speed and a smile because your time matters to us. So, are you ready to unlock financial prosperity? Highlighting key banking services such as Keke loans, Combra account, fixed deposits, SME loans, internet and corporate banking, from savings that grow your dreams to loans that fuel your ambitions. Demonstrating fast and friendly customer service. Showcasing cutting-edge banking technology and ATMs. Access your money anytime, anywhere with our state-of-the-art technology and a network of ATMs. Our Rokel SimCopper app puts banking in your hands, where you can pay for EDSA, Afri Money, Orange Money, and pay bills including school fees and make transfers to other bank accounts. Remember, you can also experience Rokel e-banking today. Then join us now. Visit any of our branches or explore our website. Rokel Commercial Bank, your bank of choice.
Sorry, car, go see some business partners.
You didn't give me my money, Michael. Can if I kiss a young, you may discount people in not to Indy. Michael, today you pay me my money. I don't send it for let you help me send money in Ghana. 2 weeks now, you don't send me money and 10 you don't give me back my money. Today, you give me my money.
You know, ever sabi goodness in life. I send back your money, but trust me, today na the very last day I ever send money for now.
I don't need your help because I don't know so with Afri money. I dey able send money. Now Baku Africa countries them.
With Afri money, we'll be able to send money to over 10 African countries, whether it's Ghana, Gambia, Liberia, or Kenya. If me party we know this, we're not for the party glamour right now.
Okay, una go regret. I mean, now una go regret.
The best part right now, Michael, with Afri money, you dey able send money even if you not use app, even if you know the online. Directly, all you need for do, you just a dial *161#. Pam, your money don't go. So I don't need the help again. Thief man.
Thank you.
Send money to over 10 African countries instantly with Afri Money. No stress, no excuses. Just dial *161*1*6# now. Afri Money, quick and easy.
feeling in the air when rain falls on a sunny day. Happy, yeah. Let the stars, let the road to be happy.
Enjoy.
As mama, I always want waiting best for me picking them, especially when it comes out waiting them for eat and drink. Now this make I always they choose Sierra juice because they make them from with local foods them and nutritious and it gets less sugar than the other drinks them. Not to me say so.
We lab test show say Sierra juice gets 50% less sugar than the other drinks them na the market.
Because we mama they know waiting best for we picking them, now you make we always they choose Sierra juice. Sierra juice and nutritious, a healthy and it's sweet. Sierra juice, not the taste of Salome.
Sumambo Pae Nangendef. This is AYV Connect with Africa. We bring you Africa's biggest conversation, entertainment, inspiring stories, and breaking news from across the continent.
Through the lens of AYV Connect with Africa, you get to see and have a feel of what it means to come from where we celebrate our cultures, traditions, and heritage.
This is where I come from, my one and only home. This is Africa.
Join us as we show you the best of the African continent. Come, let we go.
I am Abiola from Nigeria, West Africa. Join me as we connect with Africa. Ẹ̀yin tèmi báwo ni o, ṣé wà?
I am Kenshin, and this is AYV Connect with Africa, coming to you live from our state-of-the-art studios at Tower Hill, Freetown, Sierra Leone.
And this is where we get to share with you what is happening and where it's happening right now.
AYV Connect with Africa, coming to you live on DSTV channel 399.
Fellow Sierra Leoneans, on 8th August 2024, Statutory Instrument number 8 of 2024 regarding the conduct of nationwide population and housing census was successfully laid in Parliament. On 29th August 2024, this statutory instrument became effective following 21 days from its laying. Therefore, in line with the decennial census calendar, I am pleased to announce that my government will conduct a nationwide population and housing census.
It's 2026, we dey get with census. Make all man tell him from Bulem, and we responsibility for bring development. Make all man tell him from Bulem. From the east to the west, blah, 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 blah. From the north to the south, blah, blah, no matter how you dare or you try, blah, 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 blah. Motoka, mama or papa. papa, blama blama, auntie or uncle, blama blama, mochibeo. May they call you, one people, one nation. May they call you. Now we know back up bill salon. May they call you. No person say you not here. May they call you. May they call you.
I'm a papa. Make we come together now. Brother, sister, nothing saying no matter, no. No left behind, no. This night you 10-4. Can join the census. Salon now we on.
Okay, well, show me your name. Show me your address. For make you go join the plan. The census go make you get the access. For make you go vote now this land. Let the all you. If you don't want make them country again, make them creep you. Cause this time you're salon for right.
See why you been a second cabo aduo. We bring good news, salon people every year. Census don't come again. We ready for contact, sky from the young to the old. Say the census go help make development day. Allow me them continue until you know go pay. It go air plan more schools, hospital and lights, even water for you community. Who say you there?
May they call you. Yeah, one people, one nation. May they call you. Now we know back up bill salon. May they call you. No person say you not here. May they call you. May they call you.
Census they come, the other we cooperate. Tell mama and papa, then get for country all, yeah, make we all ready. Census go help for make we know we safe, and who say we stand. If you claim say you love salon, who say development day, na day you for day.
Yambo tegina, mimbo tegina, mingo tetege biambe. Got 2026 census na me right, census na you right. Family, imagine if they count everybody they left you out.
Amulemba kotumogbawa, uboka kufuni ngesa gbele tuwa. Tonya, ye amubuji hule banda. Wabulo le tabogbawa baya ganga. Ye tumogbawa mudagbe behave. Kometi ya go salon bate mukoleva. Nabi yina na meta tabogbawa na. Yo mama kome kolabo gonya delega ina.
Kakotone dim ding dang, dim ding dang, dim ding dang. Katap kata tinganga be kata konkel, anga be kata banganda yer. Abagat obagat, I no go. Agalene, samo jamu, agatamu, tarentamu. Donye, mama marita gangonsu.
Ame ya timi wandi, timi wandi. Ame ya timi wandi, timi wandi. Mwakongo tami wandi, ungewa menda milwena wo. Ya kongo tabi wandi, ungeba handa bebe holo.
From the east to the west, blama blama. From the north to the south, blama. No matter how you dare or you try, blama blama. You want to go, mama or papa, blama blama. One picking on grandpa, blama blama. Auntie or uncle, blama blama. Mochibeo. May they call you. Yeah, one people, one nation. May they call you. Yeah, now we know back up bill salon. May they call you. No person say you not here. May they call you. May they call you.
You're watching AYV Wake Up Sierra Leone here on channel 33. We're live on radio and FM 101.7 on DSTV channel 399 on our Facebook page AYV News. Coming up on the program this morning, Sierra Leone today joins the rest of the world to commemorate World Health Day on the theme Together for Health, Stand with Science in Tackling Global Health Challenge, including One Health approaches to protect people and the planet. And also we shall be discussing the state of Sierra Leone's healthcare system. Also in our show this morning again as well, we shall be talking to the country's Minister of Employment and Labour and Social Security, Mohamed Rahman Swaray. He'll be speaking on his transformative leadership digital work permit system. and also the national minimum wage from 800 to 1,200, amongst other things. But as always, keep those comments and thoughts coming into our Facebook page, AYV News, and be part of the conversation. Now, as we know, Sierra Leone today joins the rest of the world to commemorate World Health Day on the theme Together for Health, stand with science in tackling health challenges, including One Health approaches to protect people and the planet. And the World Health Organization launched the World Health Day 2026 under this theme, Together for Health, Stand with Science. It is not just a slogan, as you know, it's a global call to rebuild trust in science, fight misinformation, and strengthen health systems through evidence-based action. And the big emphasis this year is on One Health approach, linking human health plus animal health plus the environment. And today it's not just about hospitals, it's about how science, trust, and systems can come together to keep a nation alive. In the studios to help me discuss this and more, I have with me Harold Thomas Lisk, Communications Lead, Ministry of Health, and also Victor Lansana Kuroma, Executive Director of Health Alert Sierra Leone. Good morning, gentlemen, and welcome to AYV.
Thank you for having me.
Mr. Harold, let's start off with you. What's the status of healthcare system in general in Sierra Leone? Where are we at now?
Well, I was thinking that we would deliberate on the theme today, but as you have asked me this question, the status of the health system in Sierra Leone is far, far, far more advanced than it was 10 years ago, 5 years ago, and even 1 year ago. There are a lot of improvements in the healthcare delivery system. And when we talk of health, you know, now we look at the general perspective. It's not the human health, even animal health, environmental health. You know, we live in a space wherein all of these work concertedly to make sure that the living standards of people in the country is improved, and also that health is being promoted and lives are being saved and livelihood. So on the whole, I would say it's you know, far more advanced than it was even a year ago.
And how would you say science has helped in the health system reaching this mark?
Well, you know, health in itself, again, or when we talk of the Ministry of Health, or we talk of partners and all, you know, everybody, every entity collaboratively, we are a science-based organization. So what we do is based on the science. We do not do things at face value. We make sure that whatever we do is data-driven, is evidence-driven, and it's based on the science. Because in today's world, there are a lot of diseases, emerging diseases and reimagined diseases, you know, and you know, there are diseases that we have long forgotten that are actually coming. So there are threats, and you know, in this space that we are in now, we see disease travel at the speed of a jetliner, meaning one can take is breakfast in Sierra Leone and take lunch in Ghana, you take your dinner in Brussels, and you take your supper maybe in the UK. So disease travel at the speed of a jetliner. So with this, it's important for us to use scientific means, pure science, social science, and all it takes to make sure that whatever we do is evidence-based and is driven by the science.
Government says progress is being made, particularly in the health sector. If we look at this progress and if we try to measure them, Will there be a scientifically backed data, to look at the improvements that have been made so far, and where have these improvements been made? Are we looking at, medicine? Are we looking at the workforce? Are we looking at the general output of the health system? Where can we pinpoint and say we have data or science to back this progress?
Well, it's all over. When we look at maybe all of what we call, the core capacities, within health. If you take medical countermeasures, you take risk communication, you take, all of case management and all of this, everything is driven by the science. We make sure that we now have a very, very strong, evidence-based system in the country, and everything is based on, it's data-driven. So, and then we use this to see how far we have gone and what we'll do to make sure that we improve, the systems. So it's, as I said earlier, it's based on science rather than at face value. There were times, in the past when we just think at the top of our heads to do anything, but now it's being driven by the science. Let's take, for instance, when we have these outbreaks, for the last outbreak that we have put behind us, the Mpox outbreak, we make sure that we use science. We look at how these cases are going. We make sure that we monitor the trends, and looking at it, we know what interventions to do. And when these cases were going up, people were saying, okay, these cases were going up. Then we said, okay, we have seen this, but we, would actually manage this as events unfold, as the science unfolds. And even what we postulated exactly became true when we actually came to zero for a long time, and then we actually made sure that we declared the outbreak over. So, and we are using not only what evidence we have in Sierra Leone, but also in other in countries and territories around the world. We use to compare and make sure that we learn from whatever we are doing, and others are also learning from us. This is how what the science dictates.
Victor, as a civil society activist, and from the civil society's perspective, where exactly would you put Sierra Leone's health system today?
Yeah, so I think we have come a long way as a country where, we have had a series of, episodes of, pandemics, especially when we talk about the theme today, where do we stand in terms of science, which is very critical for our health sector. And as a country, I think some significant gains have been made in terms of improving on the health service delivery. Of course, we have indicators that we can rely on, when you want to talk about maternal mortality, infant mortality, and the likes. So we want to see, as the theme suggests, Together for Health, stand with science, is critical. In other words, this theme is really just bringing us, reminding us to what extent are we really relying on our data, facts, not, like what we used to think, that type of data that people just perceive. Here now, it must be evidence-based. And so, as a country, I think this is where the direction is going to be focused, because as we are aware that pandemics are still around. as a country. We are still not free from that. We have seen over time the involvement of those pandemics from Ebola. After that, we saw Corona, Mpox, and the likes. So the question you want to ask now, are we there as a country, to be able to provide the data that we are really asking? What can inform our decisions? What can inform our policies in terms of making sure that, yes, we are on track in making those decisions right? To what extent has our ministry, as a government, be able to embark on, real research that can inform us, that can tell us that, yes, from this angle, this is where we were and this is where we are now. And so in the event anything happens again, where are we going to start? Can we hit and run? Or we're going to start all over and the like. So I think this is the reminder, that's the clarion call, for us to rely on science, evidence-based data, making sure that even our advocacy, they are based on evidence, that we have the data we can provide that can showcase of what we are doing or what we have done in the past. But then honestly, I will tell you, a lot of significant gains have been made in the health sector over time, over the years, as Harold mentioned. But of course, that should not make us complacent at all, meaning we should still continue to make sure that, we are able to catch up with times, as the global trends now, we all know what's happening. If you look at the economic situation now, what's happening at global wars, are we ready to invest on those technology, those sciences? Do we still want to rely on paper-based data collection and that kind of thing? Technology, how do we improve on that? We're talking about telemedicines. All of these countries are fight and the like. So that is the direction. That is exactly the discussion for this team, And I think we still have a lot to do, but like I said, it's a long journey. We've come a long way, and I think with the preparation of the ministry, the team, the minister, and all this team, and all those who are actually within the ministry, I think this is the focus. That is the focus, and I think we will get it, or we'll get there someday.
Victor, are we investing in the right priorities? I'm asking this because if we take a critical look at, the theme itself, it is wide. For instance, the emphasis this year is on One Health approach, linking human health plus animal health plus environment. We seem to have all of these problems here. Time and time you hear an outbreak of, this disease affecting animals. You hear environmental issues. People are degrading the environment, cutting down trees. You also have issues of human health. We've had an epidemic and a pandemic. At the end of the day, how do we cope? Do you think we have our priorities right in tackling all of these? Looking at the broad-based approach of this team this year.
So yes, so basically, sometimes the priorities could be there, but the resources also could be another challenge. So how do you link all of these things? Now, yes, as you said, this is like a tripartite kind of, where you look at the human on one end, the animal on the other end, and then the environment, zoonotics. We have seen over time, even when sensitizations are being done at community level to raise the awareness of citizens' understanding of, the effects and the impact of, these animals, which ones are edible, which are not, which ones are transmit diseases and the likes. Sierra Leone is a country where over time we have so much relied on, living on animals that we fetch from the bushes and, use them as our products of consumption and the like. So it means that our people still need to have a lot of that awareness that at the level we are now moving, You imagine when somebody say, oh, monkey, over years, people have used to eat a monkey. And so which type of monkey specifically that are prohibited from eating? But then the research shows some of these monkeys could be the very infected ones, but how do our community understand that? How do they know that these are the ones we are talking about and the others are actually not the category? And so this is where also the awareness comes in, a lot of awareness, a lot of investment in terms of our resources, so that at the end of the day, whatever the priorities we'll be talking about here as a country or as a ministry, we are able to lay them bare and at the same time, provide resources to do those implementation. It's very important. It's very important. That's why in our advocacy over years, and even as we speak, we have always said the Ministry of Health need definitely resources. There could be no way we can, or the ministry can achieve, or we can as a country achieve all of this if it is not well funded. It should be well funded. They need to have all the resources that they need to have to do the work very well. Because we all saw the experiences out of the previous pandemics. What happened? If there were not commitment from donors, partners, and that kind of thing, it could have been also disastrous. We suffered under Ebola, but then the situation got improved when we have Corona because of the past experience and all of this. And then those resources that were available. So it's a meaning we need to sustain them. We need to make sure they are available for healthcare service delivery. That's the only way we can do to make sure that we are able to avert any future trends or any future pandemics, as the case may be, and that's the only way we think those priorities can be well addressed.
Harold, let me bring you in. The theme also touches and concerns science and communication. And for the longest possible time, we've been discussing on, misinformation, disinformation. How is the ministry fighting misinformation and building trust, in science? Because at the end of the day, you saw what happened during the Ebola. People were even tampering with the figures, or the notices that were coming out. The same happened again during the COVID-19. How is the ministry handling misinformation and disinformation?
Yes, this is one of our strongest area when we communicate risks and events information and counter misconceptions and myths. We have a very strong system, of social listening and rumor management. In fact, we started with rumor monitoring and management, but in today's world now in Sierra Leone, we are very strong in what we call BIIM, that is Behavioral Intelligence and Infodemic Management. And let me tell you that Sierra Leone is very, very strong in this, and we've even been approached by the Gambia, Guinea, and some other countries to make sure that our own system, digital system that we are using, we replicate. And even as far back as 2 or 3 days ago, we had meetings on this, and we are trying to make sure that they use our systems which are interoperable, because we monitor everything on a real-time basis. We started with what we call the rumor monitoring tool that we were using, the different apps like Power BI and all of these things to make sure that we log all of this information together, and then we make sure that we address concerns. Because in misconceptions or rumors or misinformation, when you do not address concerns of the people, then these rumors go up. But if you see that you are addressing the concerns, you are monitoring them on a real-time basis, then it virtually drops. So this is one of our ministry, that is behavioral intelligence and infodemic management. And as I'm talking to you, on a daily basis, even when I am in TV now or anything happens, is being monitored and even logged, through, social scientific measure, means. So that is very strong, because had it not been very strong, we would not have been able to gauge perceptions of people, see what is happening, and we started all this like on a very, very low pace, but now we have improved, and Sierra Leone is now offering, these services to other countries, and a lot of other countries would want to learn from us. And maybe in a year or two, the system that we are using in Sierra Leone, the ECOWAS, the West African Health Organization, has actually consented that this will be replicated in all the 16 countries in West Africa, and I'm very sure it will go beyond this. Our infodemic management, or what we call behavioral intelligence, is actually very strong, and we are improving on this. And the Ministry of Health, even this year they launched a digital information system that so everything that is being done now is not by paper-based. Everything is being done electronically, and that's the way to go. Even for maternal mortality is being monitored digitally. Just a month ago, the Minister of Health, launched the 300 days of activism to make sure that maternal mortality is being dropped in the country even lower than what it is, so that we would not have any preventable death, in the country. So these are all the strides that we are taking, and we do not do these ones are all being done, with the science. The science actually dictates whatever we are doing.
And if another Ebola-like outbreak happens today, are we truly ready? Whilst we're talking about science, bringing in advanced science into our healthcare system, we saw what happened. We were overwhelmed with the Ebola. Our healthcare system wasn't even able to detect what was it at that time, because we've never had an Ebola outbreak before. Ebola, as we knew it, was only centered around Central Africa. If we have an Ebola-like virus now, or an outbreak, are we truly prepared to tackle it?
Yes, of course. Now, as I told you, it's quite different from what obtained in the past. Let me just give you an example. Just last year, there is, and you are talking of Ebola-like illness. Rwanda had Marburg virus disease, which that is just a close cousin of Ebola. When Rwanda had this, the first step they did was, people were behaving as when we are actually how Sierra Leoneans were behaving when we had this the Ebola outbreak. They were going into the woods and all of these things. The first thing they asked us to do is to help them with the risk communication, which involves the behavioral intelligence and all. And we were able to send advices to them to help them set up their systems. And again, the team, a medical team, went, to Rwanda, and within the record time they were able to, get done with Ebola, and they all came safe and sound. So if we are able, we have gotten to the stage where we are able to even help other countries. Just late last year again, Namibia also had an mpox outbreak. They actually they wanted somebody from risk to do risk communication. Well, because of my work, we've trained a lot of people. We actually made sure that someone actually went, and we got very good reports, because within record time again they got done with the mpox outbreak, and there was also another outbreak. I think it was a measles outbreak that individual also helped, and they even did not want they did not want to release that person, but we actually prevailed on them because we do not want to weaken our system. So we have gotten to the point where we are actually helping other countries. But 10 years ago, 5 years ago, it was not the case. There are now lots of epidemiologists in the country at all levels, at intermediate, advanced level, and even frontline level. So today we would not actually call for epidemiologists from other countries to support us. Rather, we would even send epidemiologists outside to other countries to support them. So this is the trend. And whatever we are doing, there are networks. There are networks as I'm talking to you. All of the other countries at ECOWAS level, we are members. Even for risk communication, as I'm saying, we are members of the network of risk communication specialists. And for the whole of Africa, even Sierra Leone is a member. I'm one of the executive members of what we call the COPA, the Health Promotion Community of Practice in Africa. So we have a way of interacting with each other, exchanging ideas. We have a lot of webinars. We have a lot of online interactions, and even presence-based interactions. And so it is for laboratory, so it is for medical countermeasures, so it is for all the areas in health. So that's how it is right now, and everything is because of the science. I can sit in my desk now. If I just look at the dashboard, I see what is going on in other areas, and for instance, we have gotten what we call a calendar of diseases according to the season that these diseases come up. So we look at this calendar, and then we begin to get messages or get preparedness for what would happen. We say maybe in December we're expecting flu-like illness, or we would expect measles, or we expect this and that. All of this is actually based on scientific methods.
Mm-hmm. Victor, let me bring you in now. Well, if we look at the theme, Together for Health, stand with science in tackling global health challenges, this does not only limit or mean, scientific groundbreaking research. It also means capacity building, the human capital development within the health sector. Where are we when it comes to that? Do we have professionals who we can rely on? Harold was just making an example of what we can now export to other countries in terms of the expertise we have. But when you go down to the healthcare centers, the hospitals, the PHUs, do we have professionals who can really handle the healthcare system at the ground level?
So, basically, actually, irrespective of the gains, because the fact remains here, as you rightly say, at community level, I think this is where we still have a little bit of challenge in terms of, equality and equity, which is very, very important. What I already say here is essentially very important, but we want to make sure at that community level who are the experts that are there. It's critical, it's very critical, because we all know the challenge of the human resource at the moment within the sector. Government is battling or grappling of making sure that they provide pincos, recruitment to staff, and and then the other most important thing is this staffs are being recruited and trained, maybe all of a sudden, within a tick of time, they are again removed from those centers because of the limitation or the limited number of those personnel. So again, it's a very important aspect of how do we sustain those staff at that facility level. If you train them, how do we ensure that they continue to serve in those communities, right? Because all of these things we are talking about, sometimes the challenges start there. It's emanate from those communities. You know, when you don't have those type of experts to actually stay with those communities, to be able to guide them, to kind of direct them onto those issues that commonly that can cause a spread of, you know, disease or any infection, could be a very challenge. We see most times the most prominent train and qualifier are centralized either at regional level or at district headquarter level. But like you rightly say, at PHU level, where we have areas like Riverine and the likes, how do we keep them there? We all know also the challenges that it's faced in terms of accommodation and all of these things. Do we actually have that provision to keep those experts stay in those communities? So it's a collective approach, you know, and that is why if you look at the theme also, it talks about collaboration and partnership, which is very, very important. You talked about misinformation, you know, just now, and how do we ensure that we are able to give out timely, sensitive data that can prevent, you know, that type of misinformation? How fast do we make sure our information are out there to the public, so by the time the public wants to give out the very wrong information, we are able to tackle it and correct it instantly? So I think that's where the progress is happening gradually. I know the fact is we have not got it outrightly right now, because I know it's technology, science, it's expensive. I mean, let's don't underestimate that. It's extremely very expensive. So, meaning we need to focus all our investments to making sure that those things are actually sustained, they are available, they are sustained, and then the human power or the manpower is able to be kept, you know, so that at the end of the day, wherever you are sending that kind of personnel, that stuff is comfortable, you know. Motivation. We must have to motivate them, you know, because if all of these things are not, again, well kept or provided, then again that could be a challenge. I agree, Harold said, training has been done, you know, but how do we sustain that? What I mean, how do we sustain those personnel at that community level, you know, so that at the end of the day, they are not being, you know, because of the amenities that are not available in those communities. You know, imagine somebody who wants to equate himself. I have my colleague who, okay, we all train together. Oh, he's living in Freetown. The lifestyle he's living, and look at me here, all the way in Kurubula here, or in far remote Kailan, way beyond. How do you know? There's always that human nature comparison, you know. So if we don't keep them there, we don't maintain them, we don't make sure that we are able to provide at least those basic amenity for them, is a problem. We know the challenges of electricity everywhere. Even within the city, we have a serious problem with electricity. So those things all, and that is why it needs collective approach. One Health means collective approach. It's not only in the hands of the ministry. If we are talking about energy, we are talking about power, solar, we are talking about, it needs also the support of other ministries to come on board, right? To make sure that all of them are able to contribute in supporting the sustainability of the gains that are being made by the ministry. Because if it's only left in the hands of ministry alone, then we all know it's a challenge. Everybody has their own priority. Ministry of Agriculture have their own priority, Ministry of Energy have their own priority, and that kind of thing. So everybody is fighting to make sure they protect their own budget or whatever it is, but not at the expense of health, because health definitely cuts across all major sectors, right?
This circles back to what you spoke about earlier, the issue of resources, you know, not being available. If we're talking of whether we have, you know, trained and qualified medical practitioners or staff that will handle these ground level, you know, medical needs and attention. ECOWAS countries generally spend below the recommended, you know, 15% of national budget. Most of, you know, countries in West Africa rely heavily on donor funding, and we know there's been issues with WHO and funding being cut. how are we going to upkeep this, as a country, specifically the Sierra Leonean situation? If we're talking about, relying on science, it means we should up our game when it comes to, early detection, when it comes to the facilities we have. They should be at par with our sub-African nations. We're also talking of, capacitating, the manpower in the health sector. But if we still rely heavily on donor funding, how are we going to achieve that?
So yeah, it's actually, these are the issues we keep discussing. And, I'm a member of the Health Finances Strategy Committee. We have always been discussing all this. What type of initiatives do we have as a country? How do we ensure the health finance strategies? It's been launched by government, but then how do we support that? And that brings also to, as a country, how do we embark on our domestic revenue mobilization? And how do we prioritize them for health, for instance? We have series of other commitments as a country. We have co-financing commitments and the likes, and all of these things are hanging. Now with the global trends, as you rightly say, economic trends now, every country is now focusing on how do we make sure that we sustain those gains that we have already achieved. So it needs resources, but how do we get those resources? This is where, as a country, we bring in a lot of these initiatives, right? Tax incentives, for instance, people don't like to pay tax. But these are the funds, the monies that we are depending on from other countries. Donors are giving, You are perfectly correct. As a country, most time we are so much dependent, so much reliant. But then look what is happening now. Donors are phasing. Everybody is now focusing back. War in Ukraine, war in Iraq, war in this, war, all these things. They are now focusing their attention there. So as a country, if we are not prepared to be able to sit up and start to say, how do we tap into the resources that we have? It's so heart-rending. When you go out of this country, you say about Sierra Leone, somebody will just Google and say, what are the resources that are available for this country? And somebody wants to say, how can you live by the riverside and wash your face with spit on? Right? Meaning people think with all of these resources that we have here, yes, we are still depending. So meaning it now needs strategic leadership. It needs strategic prioritization where our resources, how do we make sure those resources are well generated and kept and used purpose. That's what we are discussing at the health financing level, to see how do we make sure we finance the health sectors specifically with our own resources. I felt good when just recently I saw the president launched projects in 5 districts where donations are made, and these are funds that were provided by government. That's the kind of thing we want to see. That's the kind of talk, so that even when the donors themselves start to see, the country is now making gains. The country is also now trying to depend on their own resources. Then the donors will not have too much to charge us. They will not also have too much to dictate us how we want to do. But when you don't do that, then the donor direction is what you have to follow, right? It's what their interest is, what you have to do. So I think as a country, we have not got there yet, but the pathway is there. We are on the pathway, because when all of these policies, all of these strategies we are talking about here, if they are well developed, it's going to work. The selection government is also intending, making sure the selection becomes effective. I'm also a committee member in that selection committee, where we have done a lot of accreditation in almost all the facilities across the country. So at the end of the day, so that those facilities that are be able to provide the services for the people have the opportunity. So those who can afford to pay, at least can pay for those who cannot afford to pay and the like. So all of these plans are really, on the table. They are on the table. So yes, I think I agree that as a country, the only way we can try to at least, make sure that we reprioritize our donor landscape, and is to make sure as a country we are able to actually maximize our own resources. We generate them, make sure we use them, and prioritize them very well, because it's unfortunate. As we speak, if you look at the Ministry of Health budgets, you talk about 15%. We are not there. At some point, we were very close. We were up to about 11, 12%, but all of a sudden, we came down, we dropped again, So that tells you, and again, this all, for donors, they will say, why are we really serious as a country? Why do we keep going back and forth and that kind of thing? So, but it's all about prioritization, like I said. And for me, my passion is health. And anytime you hear Victor speaks, it's about health. Because I'm also a personnel from there. So I know exactly what it means. So that is why everything that we say we discuss on health is making sure that we all put our efforts together to make sure that the health cannot be micromanaged. The health is not something you can defer. You can't defer the sickness for anybody, And so therefore, in terms of resources, we must invest there. We must make sure that we prioritize our resources there so that, at the end of the day, whatever comes our way, we are able to tackle it. Whether it's a pandemic, whatever situation that may come our way, our people are able, because it's a challenge now. As you talk about out-of-pocket payment, so speak, it's 56%, meaning the body is shifted on the people, right? And when you shift the body on the people are paying for the services, I mean, you talked about trust, you talk about confidence. All of these things will boil around that. If I go to the facility and I'm, maybe whatever amount I have with me, I was not expecting, that's what I'm going to pay. It kind of like it will be either embarrassment or a setback on that individual who at that moment probably do not have that money. It's very important. So once this data is informing us that, oh yes, what out-of-pocket payment 56%, many people are paying for those services. So what do we do as a country, so that at the end of the day, we do not heavily that financial burden, financial catastrophe on the people. And that's why government is bringing all of this initiative, this SLESHI, health finances strategy, and all these things. Once it is funded, it's well managed. Trust me, I think the people can have that confidence. The people can have the trust. They will wake up and say, let me go to this facility. I know when I go there, I will get my services right. I will get everything that it takes that I want to get without, running helter and skelter to look out for medicines and that kind of thing. But if we continue to allow frequent stock out of drugs, for instance, and people go to the facility and drugs are not available there at that material time, they won't go there. Then at the end of the day, what happens? We are against, what backyard treatment. We are against, quacks, taking a center stage of treatment, But how do we address that? How do we mitigate that? Until we are able to equip our own facilities, our own hospitals and the likes, and all of these things, I mean, it's a problem. You also go to private. Again, my other also is also driven, my knowledge also driven to private facilities. My concern has always been, how is government monitoring? How is government tracking the data that is coming from those private facilities? All over Matia, you agree with me. There is a huge proliferation of these facilities everywhere.
That's what I wanted to ask. Whether as civil society activists, whatever you look to do, because with all the private hospitals we have, people still rely on traveling abroad for medical care. You see people relying on going to Ghana, to India. If we agree that our government healthcare system is not that strong, and we have private institutions who can step up, but then still we aren't there yet. So where are we really? Because most of the services these private institutions are providing, governments are also providing.
Definitely.
So where are we?
So again, it's about collaboration, like I talked about earlier, and that's what the team is really emphasizing. How do we partner? How do we collaborate? You talked about external treatment, foreign treatment. Honestly, I agree with you that I have been part of the health advocacy, budget tracking, and with the ministry. Honestly, the record shows that even the Ministry of Health budget, right, a huge chunk of that, right, is on foreign treatment. You know, I honestly, I know the ministry is not too happy with that, right? The Ministry of Finance has always been asking this question, guys, what are you doing? Because if you look at that budget line alone, you know, that takes care of that huge aspect of the budget for foreign treatment, why can't we use that money? You know, it has been a repeated question each time we go for this budget discussion. You know, the permanent secretary of Ministry of Health has always been asked the director, how do we change that narrative? How do we make sure that we really invest on our own local facilities so that people will trust in that system? People will go there and make sure that I have all the facilities that it takes, you know, to get my services here without recourse to international, you know, trip. You know, these are expensive. I have tested one. I know what it cost me. I know when at the end of the day I could not get what I wanted here, my physician has to refer me all the way to India, and that was terrible for me. You know, otherwise I could have even lost my life. So so you start to ask yourself all of these things. So we have the personnel, we have the manpower, we have everything. Like Aaron has already said, all of these things we have them. But it's about resources, financing them, making sure that we invest on them so that the people have that confidence to go there and get the services and come out without that emotion or that, you know, kind of high kind of palpitation of saying, where would I get this money to go to India? Where would I get this money to go to Ghana? Talk about flight alone and all the rest of it, accommodation, you put all together. So you see, so that is why I think the team is not only reminding us to look at global crisis, but it's also looking at us domestically. How do we also at local level here, how do we strengthen our health system by investing our own resources, our money? That's why I talked about tax. People should be paying their taxes. All of us as Sierra Leoneans, those resources that are available, right? Minerals, whatever you think. You know, it's ridiculous to say Sierra Leone has over 13 type of minerals. How we manage, how we getting the private sector, how we getting, how we tapping from them to make sure that we are able to get these things right. I know because health, honestly, it's not on the government account, but the private sector on their end have their own facility. But how do we collaborate with them? How do we partner with them so that they are able to contribute also to the system, in that if they can afford to provide those services, right? Like areas like EcoMed today is doing, Ramsey and the others, you go there for tests and that kind of thing. Yeah, they will charge you exorbitantly. But if the services are available, then you don't mind paying, rather than probably somebody say, go out of Sierra Leone where all of this will take you.
The issue of budget. Do we need more budget allocation to the Ministry of Health? And if budget is rightly so allocated, can all of these problems, or some or most of these problems, be solved with just providing the resources?
Yeah, because of my public health background, I would not dive into that one because it's purely administrative, but I would say yes, we need more budget and resources at the same time, because it's never enough, even with countries that we deem as advanced countries. You know, health is so essential that even money cannot actually, you know, get all it takes. It needs a very, very high standard of dedication, commitment, and all of these ones. So, but it's capital intensive all the way. So we need, you know, more of these resources, because everything we do is actually capital intensive. You know, that's why, you know, the science is very much important. We are trying to cut down on, you know, these spendings and then a lot of inconveniences. You know, we were earlier this morning talking of you know, or I think my colleague Victor was talking about PIN codes and all of this. You know, now the Ministry of Finance or the government, you know, has actually given us, you know, a lot of like thousands, over 3,000, you know, spaces for new recruitment. And you know, in the past, you know, this is how science has improved. We have a very, very top-notch IT outfit in the Ministry of Health. You know, when recruitments like this were done in the past, a lot of, you know, people were going up and down in the ministry. Things were just disrupted and all of this. But now they use, you know, a portal which actually people will just log into this portal, put in their applications, and as I'm talking to you now, it's almost ready for interview. A lot of people have been shortlisted. Those that have actually not even been successful were actually informed to, you know, digital methods. So these are some of the improvements, and it has cut down on a lot of maybe money for people, you know, hard copies and other things. So, but you know, it's not actually enough, because the resources, as we say, even the 15% budget can, even if we have all of this, it will not be enough. We need more and more and more, because you know, to get drugs, you know, a lot of medical equipment, it costs a lot. Just the other day, the president and the minister of health, they've actually launched the CT scans in major hospitals. You know, a lot of you know, buses for health workers. These are things that actually cost money. So you know, we always would need more and more, both resources, both in terms of manpower, in terms of you know, finances, in terms of you know, a lot of intellectual resources and other things. So, and everything, if you look at it, even the time that we are spending here, if you look at it, the social costs and everything, it's you know, capital intensive.
Victor was also talking about the out-of-pocket payments, you know, putting it at 56% as it stands. That, you know, the chunk of the burden to pay for healthcare falls on, you know, the person that needs the healthcare facility. We have private institutions, you know, that will substitute for what we need when it comes to healthcare. But at the end of the day, more is needed. I am concerned. You know, you just mentioned even developed countries, even America, people are saying they need more hospitals, you know, they need better healthcare system, you know, it's expensive. In places like England, where healthcare is almost virtually free, people still, you know, grumble that, you know, there are concerns there. But how can we tackle our problem here? That's why I asked whether resources can help in the first place, whether budget allocation can help. We've spoken about, you know, the need to introduce, or how far we are going with the introduction of science in our healthcare system. But then at the end of the day, if we are to keep, you know, at par with other African countries where we go to now for healthcare interventions or facilities, where should we strengthen, you know, as a country or as a nation from the government's perspective? Where should we look at and say, this is where we need to tackle for us to start, you know, comparing ourselves with countries like Ghana, for instance?
Well, that is why we have what we call the universal, you know, care. We are looking at this at a cost that people can afford. And there are different levels. For instance, when we talk of the free health care, there are certain exemptions for people. And even, you know, when the universal health is looking at, you know, the health care at a cost that even when people would decide, would be asked to pay, it will be affordable without any stress, you know, that you can do actually seamlessly. And that is what we are doing right now. We because there are certain categories like pregnant women, like children under 5s, these ones, there are exemptions. And in cases where people would have to pay, it will depend on your own choice, because if you decide to go to the government facility, some of these things like vaccination, and a lot of other things are pretty much free. But some individuals might decide to go to other facilities that are not free, they are not private, because of maybe some of them will look at it as a status symbol and all of this. So it will depend. But the government is actually trying to cushion these things in a way that people would not see it as an extra burden. So it should be at a cost that they can afford it. The affordability is very important. The accessibility is also overly important as well.
All right, so let's take a look at the comments on Facebook so far as we round off. Swissman says, health is expensive all over the world, but we need to ask the question, do we have a specialized equipped facility where scientists perform experiments that our medical practitioners can use to combat, for instance, malaria, tuberculosis, and kidney disease? Because we should not be praising ourselves when we know that things are not working perfectly, as we are all aware. If our medical system is good, we should not be having frequent deaths in the country. And if we know that our healthcare system is not that perfect, but we are pretending as if it is perfect, we should accept that all it's not good, so that we'll find ways to upgrade ourselves. Because if our health department lacks the quality, we'll never be healthy as a nation or to be able to fulfill our development goals. Sometimes even the water that we consume do not have the quality to prevent us from diseases like cholera, malaria, and there are a lot of villages in this country that doesn't have hospitals and qualified doctors or nurses, talk less of pure drinking water that can prevent some of the people from dying. Mystic from Dazak says, as Sierra Leone joins the world in celebrating World Health Day, this should also be a moment for reflection. Our health sector continues to face serious challenges, especially weak monitoring system and limited doctor availability. Too often, public health care suffers, while some practitioners focus more on private clinics despite receiving government salaries. Strengthening accountability and commitment is essential to improving healthcare for all. Harold, your comments on those?
Yes, some of them are mere comments, they are not questions. But as I have said, and I will continue to say that, and all over the world, things are not perfect. We would not say we are perfect, but what we are saying is that a lot has been done. We have, as Victor said, we have come a long way, but I know that we still have a long way to go, but things are getting better by the hour. When you look at the improvements, in the Ministry of Health, and I would not just say Ministry of Health, I would look at this on the One Health perspective. Ministry of Health, Ministry of Agriculture, Ministry of Environment, because there are diseases, conditions, and diseases, events, and conditions of public health importance that are outside the realm of just the Ministry of Health. We have a lot of diseases as zoonotic diseases. They come from animals and even the space. For instance, when you have anthrax, it's in animals and it can actually transfer to humans. And the space where this occurs, this anthrax germ can be there for as long as 100 years. It can stay dormant, but if the environment is conducive, after 100 years, it can come up again. So it means that a collective responsibility from health workers, human health workers, veterinarians, environmentalists, and other things. So when we talk of health, let us don't just look at the hospital, the Ministry of Health. Let's look at even the Ministry of Agriculture, how they take care of their animals, how they take care of the plants, how the Ministry of Environment take care of the environment, their climate change. Because if there are diseases that would occur during the rainy season, and if we have prolonged rainy season, there will be more of these diseases. And if there are diseases in the dries, if the condition changes, if we're expecting it in March, maybe it will be in July, for instance. So there are a lot of things that we see. What we see are the rippling effect of, all what it takes. So it is a whole of government approach and a whole of community approach. So the community has a role to play in this, not just the Ministry of Health officials, not just government officials, but all of us. If we look at things today, look at these drainages. These drainages are made to make sure that water, wastewater flows. But these are used as dump sites. In spite of all the efforts, you will see people going at night throwing these garbages there, or some people are just connecting their sewage pipes in streams where people would wash or do other get fresh water to drink, downstream. These are community people that are doing it. It's not government officials, it's not the Ministry of Health, so it's a whole of community and government approach. So much as you are saying we should do more, we realize that we should do more. That is why we are doing more every day. But we should. It's a concerted effort all together, because if you know that your animal has died of an unexplained disease, for instance, if 2 or 3 cows or goats or sheep are dying, within a court, a particular area, and you decide to just sell these ones to people to give them to consume. Then tomorrow, if there's an outbreak of a disease, and then you begin to say, oh, this is a Ministry of Health domain to treat people and all of these. These ones, if we prevent, they will save a lot of money. Those monies can be used for education, can be used for other things. And health is not just when we talk of the absence of disease or infirmity, it means mental health as well, emotional health, environmental health is everything. So there are areas where there is a lot of noise going on, people do not sleep. These are health issues. It's not just when you are sick. You might be okay, you might be physically fit, but you might not be emotionally fit. So there are issues that are outside the realm of what we are thinking. So, and when we say health, it's for us all, because health promotion looks at how we would be able to enable people to take accurate decisions in matters relating to their own health, and that is what we actually stand for, to promote health. So we can cut down on government spending if we actually modify our own behavior, so it's very much important. We have seen this when in outbreaks, when people would begin to do certain things, and when they modify their behaviors, within a very, very short time, you see the disease dropping down. So let us continue in this. So that is what I would say. And I would want to also recognize our health workers, and frontline teams. The health workers, the veterinarians, the environmentalists, our community health workers, even at community level. They are so important. They help towards the One Health approach. One Health, One World. And that is why anything that would, we do not want to, if health, if the environment reacts well with us, there will be no substantial health problem. But when there is a break in that equilibrium, by even man or man's intervention, then we begin to get diseases, we begin to get a lot of problems. So we ourselves are also, we should make sure that we help in reducing some of this burden on government. So that is my advice, but we pay tribute to all our health workers, even at village level, at community level, and we also pay tributes to all those who adhere to our preventive messages, because it's teaching time will save 9.
Victor, finally, as we round off, what do you hope to see, by this time next year, when we shall be discussing again another World Health Day, within the Sierra Leone context?
So I think what we should try to ensure is to make sure at least the gains that we have made are sustained. We don't fall back. It's critical. It's very important. We know Rome was not built today. I listened from the Texas, who's, actually kind of like demanding accountability. And accountability is about giving the right information. It's about making sure that, people who are put in trust, they do exactly what they are supposed to do. Rightly so, as he said, we're quite aware. There's no perfect system, by the way, no perfect system. But we know there are people actually within the system who also want to take advantage of the situation. And key thing that I picked up from there is the aspect of monitoring. Monitoring is key. It's key because if we don't monitor, we don't follow up and make sure that those who are supposed to be there, you talked about doctors leaving the hospitals, going to their private clinics, spending all their time. Yes, there are those evidences that exist, but then if we have a robust monitoring system where we know, okay, we can track this doctor anywhere he is or she is, whether he's supposed to be at the facility between this time to this time, and that kind of thing, we are able to do that. And that's what technology can do. In the world of today, while we are talking about science here, if there is a system where we can track every staff, AYV, for instance, when I came here, I saw at the door, people just thumbprinting somewhere. That is a monitoring system, I'm sure. It's to track who comes at what time and the likes. That is the kind of thing we are talking about in the health. We know it's a long way to go. We know it's capital intensive, but at least if we can also step up in our physical monitoring, how do we want to see our leadership? For instance, my brother, Mr. Harold here, he's a whole manager of a whole unit, right? So one day we just say, you know what, let me have my fill. Let me just go to Kailan. Let me go and see how my guys are doing there. On the spot visit, just on the spot, But if you don't support that, you don't have that resources, it could also be a challenge. So that's why we are talking about resources here. That our authorities are not only meant to be in the offices and that kind of thing, but then go to these facilities and make sure that where we are getting this kind of information, just do a prep, do on the spot, or use the technology to what I can track this person. I can know where you are at this moment, where you are, at this time. So that also is part of accountability and monitoring system, I'm sure you call that. So my hope next year, 2027, when we'll be talking about World Health against organization celebration, is to make sure that how effective we are able to integrate, right, our science in our database, our science in our policy makings, the science in decision making, so that we are informed by data, we are informed by our science to tell us that this is what has gone wrong, this is how we have fixed it, these are the things we need to do to put them right. That's what I'm hoping to see, because every year these teams come to guide us to make sure that we reprioritize and make sure that we are able to focus our direction and even our spending to what we think we want to achieve.
Whilst you're mentioning monitoring, Tondona is asking, who is monitoring the communities to practice healthy practices in their day-to-day living? Does the health ministry have community health system to promote and prevent diseases through public health, socio-education at local community levels? What are the Sierra Leone government and health professionals doing to standardize practices? What is the health management measures to reduce stealing in government hospitals and health facilities?
Exactly. My brother will probably conclude on that. Because that's false under his domain. It's false under his domain, but rightly so. We are partnering because, of course, our work as health alert, as civil society, is not just to stand and condemn or criticize, but we also prefer solutions and at the same time work together. He knows, as he rightly is talking about the risk communication, civil society health alert is a member of the risk communication. So we have worked things over the years for many, many times, right? Even though we all have our individual responsibilities. But then talking about actually system monitoring and community monitoring, largely, apart from what we do as civil society, most times, don't forget, as CSOs, most times, if donor gives you resources, what the donor wants you to do is what you will do. You will want to go beyond, but you are limited, But then the ministry, which directly falls under his own purview, right, I'm sure has the capacity or should be in position to be able to maybe speak onto this and address them, how sometimes community monitoring takes place.
Yes, Harold, your response on this?
Yes, the primary healthcare directorate as what we call CHWs, community health workers. These are embedded in the community, and also the Ministry of Agriculture has what we call CAWs, Community Animal Health Workers. They are also in the community at that level. So they are able to actually, at those levels, give some, health messages to people, and even get data and send to other levels so that we can actually take action. And those things that we would deem as malpractices at those levels, I say it is a whole of community approach. If we see things are going on, because we have the facility management committees, that these are committees that were set up by the primary healthcare directorate. These ones are members, they are embedded in the community, and that is why they are there. So we, cannot at national level or at district level be able to see all what is happening in those communities. So what don't say it's not your own business. It's very much important. This that we are talking about, the community has a central role to play in the success of all our interventions. For instance, trust. Verified information. Don't rely on rumors. We also report unusual illnesses that occurs in the community, even for animals, and even humans, for instance. And we should practice good hygiene practices. These are also very important. And we support public health interventions like vaccinations. We should be cooperative in research. When they go to our communities, for instance, the Sylvia project is going on right now. Where for instance, in Western area, urban and rural, there is this population-based HIV impact assessment that is going on. When they go to your community to ask you a few questions or to take a little bit of blood sample to do your blood sample, these are all innovations, scientific things that we are using to improve the living standards of people. Please don't reject them. We should all be cooperative in this. So it's very important. And then the partnership also is important, which is a collective action that we are taking. Government institutions, development partners, civil society organizations and NGO, even the media, you also play a very good part in this, and community leaders, key community stakeholders. So as I say, it is not like just for the Ministry of Health or just for government institutions. It's a whole of government approach and a whole of community approach.
All right, thank you very much, Harold, and thank you, Victor. Thank you, gentlemen, for joining us this morning. Standing with science is not just about doctors and laboratories. It's about trust, accountability, and whether the system actually saves lives when it matters most, as we commemorate this year's World Health Day. Let's take a quick break, and then when we come back, we go into our second segment of the show.
In the heart of Sierra Leone's dynamic rhythm, Rocal Commercial Bank is your beat to a brighter financial future. We're not just a bank, but we're your financial partner committed to your success. We've got the financial tools you need to rise higher. Our team is here to serve you with speed and a smile because your time matters to us. So, are you ready to unlock financial prosperity? Highlighting key banking services such as Keke loans, Combra account, fixed deposits, SME loans, internet and corporate banking, from savings that grow your dreams to loans that fuel your ambitions. Demonstrating fast and friendly customer service. Showcasing cutting-edge banking technology and ATMs. Access your money anytime, anywhere with our state-of-the-art technology and a network of ATMs. Our Rocal SIM Copper app puts banking in your hands, where you can pay for EDSA, Afri Money, Orange Money, and pay bills including school fees and make transfers to other bank accounts. Remember, you can also experience Rocal e-banking today. Then join us now. Visit any of our branches or explore our website. Rocal Commercial Bank, your bank of choice.
Sanika, go see some business partners.
You didn't give me memory, Michael.
If I can say, you know, where this can people in, not to in that day.
Michael, today you pay me money. I don't send it for let you help me send money in Ghana. 2 weeks now, you not send me money and tell you not give me back me money. Today, give me money.
You know ever sabi goodness na life. I send back your money, but trust me, today na the very last day I ever send money for now.
I don't need the help because I don't know so with Afri money. I able send money. Now Baku Africa countries them.
With Afri money, we'll be able to send money to over 10 African countries, whether it's Ghana, Gambia, Liberia, or Kenya. If me party know this, we not follow the party grammar right now.
Okay, una go regret. I mean now, una go regret.
The best part right now, Michael, with Afri money, you dey able to send money even if you not use app, even if you not the online directly. All you need for do, you just a dial *161#. Pam, your money don't go. So I don't need the help again. Thief man.
Thank you.
Send money to over 10 African countries instantly with Afri Money. No stress, no excuses. Just dial *161 *1 *6# now. Afri Money, quick and easy.
Welcome back. You're still watching Wake Up Sierra Leone on AYV television. We're live on radio on FM 101.7. Keep those comments coming into our Facebook page, AYV News. Now, in our final segment in the studio, we've been joined by the country's Minister of Employment, Labour and Social Security, Mohamed Rahman Swaray. The minister, appointed in 2023, was appointed in 2023 on his focused on digital transformation. A few months ago, the minister launched a digital work permit system, and including the increment also of the national minimum wage from 800 to 1,200 leones, effective this April 2026. We're going to discuss all of these and the transformation the ministry has been going through. Good morning, Mr. Minister. Good morning and welcome to AYV.
Good morning. It's a pleasure being here.
Yeah, let's start off with, What are the physical transformation and gains you've made since you took up office?
Also, a couple of things. One, the ministry is housed in a derelict building that I guess is older than you and I. My predecessors launched a project that I put on the fast track. So it's expected that in the next coming months, and next few months, we should get a proper, safe and dignified office accommodation where the ministry will be at Labour House, right? So that's one. We have also started some rehabilitation to some of the structures that the ministry had. You know, like I've mentioned in previous other fora, the colonialists had a lot of respect for the Ministry of Employment, Labour, right? That is why it's one of the ministries that has some of the largest number of office accommodation spaces, particularly in the western area, right? But post-independence, our governments felt otherwise. Anyway, His Excellency wants to do a paradigm shift. That's why he's doing that investment in the new structure. We are rehabilitating other structures so that we can have our staff live in dignified workspaces. As I know, that is one of the reasons why many in the public service, many civil servants don't want to be sent to the Ministry of Labour. They think it's a death sentence. It's a way of derailing your career. But we have challenged that paradigm. In the next few months, inshallah, this will be the place to be. Yeah, so that's on that side of it. The other bit we are doing right now is, you remember you mentioned the digitalization of the work permit process. I inherited a ministry since independence that has been doing work permits manually. They even felt it was a very casual kind of thing, right? Because when I took over, I realized first they were charging very, very minimal fees for work permits. 6 million, that's the highest, no matter where in the world you come from. I think that was very low. It was for want of knowing what prevails in the sub-region around the world. Yeah, so I have had a very personal experience. I had a 2-year stint in Liberia where my employers paid 1,000 United States dollars for me in 2010, 2011, 2012. So coming to a new Ministry of Labour and the highest for work permit is 6 million old loans, I knew something was wrong. So the team set upon to do a comparative study. What we now charge, where the average as in West Africa as at the time. But since then, nobody's been waiting for us. They have also moved on, right? So we still charge the lowest in West Africa. I mean, people might have their views here and there, but the baseline was so weak. That is why they saw the upward review as too high. But we are still the lowest in West Africa, right? So we've done that for various reasons. We wanted to modernize the operations of the work permit department, of the immigration department. We want people to be able to access those services at their fingertips, right? But we know that many would ordinarily not want to break the law. But when you make it too cumbersome to comply, they choose the easy route. They don't comply. So I'm pleased to note that the contribution of the work permit fees to the budget, we had about 8 billion loans, old loans, in 2023. As at the close of last year, we had 23 billion loans. And that was in the absence of any logistics, no vehicles, no motorbikes, no staff. We were able to raise that under my watch. So you could sit and watch. More things are going to happen, more interesting things. Watch that space. Now that we have taken delivery of vehicles, courtesy of a private sector contract, we entered into contrast. When I came to that ministry, I inherited the contract. They told me about it, but it was a terrible contract. It was 70% to the contractor, 30% to government. I said, look, I've sworn an oath to seek this country's very best interest. I cannot go ahead with this. We reviewed it. A new contractor came in. We did 50-50. That contractor has provided vehicles for both us at Labour and Immigration, vehicles and motorbikes. We are having office spaces across the country. What better transformation do you need in the Ministry of Labour? For the longest time, they have not had a presence in the provinces. But we can now boast of very, very solid structures, you know, in prime locations, in Bo, Kenema, Makini, Poloko. And we might go to Kono soon.
This issue of, you know...
It looks like a Hollywood, a dream to many people.
Yeah.
Even my staff. But it's not the ministry that makes the man. It is the man that makes the ministry. That's what I represent. You remember when I was in the Ministry of Information? Many felt it was about Thursday press conferences, this, that. I said, no, I'm more than a press conference. I've been charged with delivering a huge man on a huge mandate. We have to do that. Look at the reforms we left there. AYV, of course, can't benefit from the National Fund for Public Interest Media, but they are dispensing now across the country now. That's part of the legacy I brought in, right? We used to have annual media review sessions. I left in the ministry over $50 million. You know, we're already working to land a second cable. So many things we did together. So
this issue of digital work permit system, is it primarily about efficiency, or is it just another, you know, revenue generation scheme for government? The reason why I'm asking is because, as you guys said before now, even with the manual system, you still had people who were beating the system. You'd have foreign nationals who'd be here without work permits, who'd stay for you know, so many years. Will this system ensure that no one, you know, gets scot-free?
So, you know, so it's also a culture shifting. You know, Peter Drucker, one of the world's major management specialists, did say culture eats strategy for breakfast. So one of the things I've had to do was to take on the culture. We had to review the work culture. People should understand this is a key and cardinal part of their job functions. It's not one of those things, those peripheral things you just do when it happens, right? So the ministry is now more laser focused. So we can modernize the process, reduce time, get credible data, for labor statistics, also for security reasons, because when you apply for both residence and work permits, we require all of your necessary supporting documents. So that way, you know, we're able to know the pedigree of the person applying for this document. So it also serves national security purposes and, of course, economic purposes. It helps preserve jobs for Sierra Leoneans. We'll get to a point where we may not grant work permit to everybody who applies for it, because the laws are very clear. You only bring in people for jobs for which there are no competent Sierra Leoneans with the right skill sets, the right competencies, and the right experiences. However,
that's what I wanted to ask, Mr. Minister. You've worked in the mining sector.
Yes, I worked.
Yes, and people have been crying that, you know, some of these positions that experts have been brought in for, Sierra Leoneans can actually fill this position. Now, even though you say this new permit or the introduction of this new system means we're still paying less if you compare it to other
Liberia just bumped up to $3,000.
But this will now mean, you know, companies will now say, listen, I'm now paying more than I used to pay 3, 4, 5 years ago. But if I'm paying more, I would want to bring in, you know, an actual professional for this position. If you're saying, let me pay more.
Okay,
more
so let's flip the coin. Let's flip the coin. If I want to bring in a house help, and I realize it's from Philippines, for example, I realize it's $1,500, right? $1,500, you might want to, and there are other incidentals. There is R&R, rest and recuperation. You have to fly there in twice a year. You might want to settle with the Sierra Leonean. So that's one case you could make. And we really think once we change our attitude, because we also have very undesirable attitudes, I have seen Sierra Leoneans, and I have worked in many places around here in HR leadership roles. I've seen some Sierra Leoneans who come to work in the rainy season. They come late and they say it was raining. What do you expect in the rainy season? It should be raining, right? I've seen many others come and they will tell you it's the traffic. You did not leave early. And we also know the desperation to travel abroad. Sometimes you access them to the vault. Next time, you know, they have fled. Temple run with people's resources. So this debate, this should be a national debate. We don't want them to bring every manner of people, but let us be ready, all right? And readiness encompasses many things: integrity, change of work attitude, the decorum, and all of that. I am, you know, in the mines they used to come and say, I'll stand up for Sierra Leone employees. I understand that. I still continue to stand up for them, but the businesses are important. they have to create the jobs, so we have to look after them as well. His Excellency has committed an enabling business environment, so we have to ensure every inch of the way that we don't upend that. So,
do we have, since the introduction of this new system, do we have a data now that will pinpoint to, the reduction of corruption, or, now faster processing time?
Nobody is going to be corrupt in this. Yeah, if you are experts, it's mandatory for you to obtain a residence and work permit. You cut corners, do inspections, which by the way will get everywhere because we are now mobile. We've been able to have vehicles and motorbikes, which will get everywhere. You have no hiding place. Once we see you, you have to pay, and pay a surcharge. There's a fine of 5,000 leones if you work here illegally without a residence and work permit, and your employer also pay 5,000 leones, $5,000. Yeah, we want to make it expensive. We want to make it unattractive for people to do the wrong things. Why wouldn't you want to come and pay $1,500? Instead, you want to commit an offense that will lead to a fine of $5,000.
Mr. Minister, in a ministry where people have refused to work before and have seen the ministry as, a point of demotion, you're now introducing a scheme that will bring in more money. Isn't that an avenue for some people within the ministry to be corrupt?
Well, nobody's handling money. That's the good news. Yeah. We have reduced that considerably. This is not it's not going to be the normal manual transactions. It's not just the work permit process that will digitalize. Everything relating to it, every aspect, including payment for it. So it's not manual. The human interface is considerably reduced. So nobody's going to be corrupt, So this is just part of the reform process. We have many other things in the works. We had the factories inspectorate division. They should come to every place where there are factories, inspect those workplaces to know it's safe. If you have those machinery, they could test them to see if they are okay and all of that. They also do trade testing for young Sierra Leoneans who have never been to a formal school. You now come, you want a validation of your prior learning. We used to do trade testing and all of that. You are a carpenter, they test you, you are a mechanic, but all of those machines are gone. I'm pleased to note that we're in advanced stages of discussions with a potential investor who wants to invest in that sector. I think we lost that since the war ended, So we are rekindling that. We are reimagining it, we are bringing it back. Yeah, in the next couple of days, we really expect a sea change of reforms in the ministry. And apart from that,
is the system foolproof? And you're dealing with data of people. How protected are the data?
Well, that's one of the things we considered. We have had this system is one of the very best that you could have. But even the best systems can be susceptible to vulnerabilities. So we have done the very best we could. We'll continue to strengthen it, but we are not sure it's foolproof. I mean, no system it's foolproof. But we have done our very best in the circumstance, and this is one of the very best that anybody could offer.
Let's talk a bit about the minimum wage, the increase from 800 leones to 1,200 leones. There's always an issue around the minimum wage and its compliance, whether companies and institutions will indeed comply, to this increment. And rightly so, that increment starts this year, this month, meaning at the end of this month, all those who were earning less than 1,200 are expected to now earn the minimum wage. How is the ministry going to create a policy around this to ensure that institutions and companies comply with this?
Well, so if you read the Employment Act, there are clear provisions there for non-compliance with, the policies and provisions of the Act. So this is one of them. There are clear obligations on the part of employers to ensure that they honor the basic minimum wage, like all other contracts they enter into. So, we expect that we'll get feedback from members of the public, those who should benefit from it. Let us know if your employer reflected that in your end of month salary, because we don't have a way of knowing if nobody talks to us about it. We will think everything is hunky-dory. But if you tell us we have not been paid the minimum wage, we'll swing into action and be sure that employer will comply, because there are clear penalty provisions in the law for non-compliance.
Mr. Minister, have you assessed whether small businesses can realistically sustain this increase without laying off workers? I mean, I'm really concerned with the informal sector. Although they are paying tax, again, it comes to the issue of compliance and how would you ensure that smaller businesses comply with this increment and whether they can really keep up?
Well, in many places around the world, in the UK also, the family businesses, the small businesses really do the great deal. They employ a lot of people. They still comply with the provisions of the law in the UK. However, your concerns are legitimate. They have been a subject of conversations with small businesses, right? They are concerned we should not hold them up to the same standards. Liberia has a two-tier system. So this is an ongoing conversation. It's an ongoing conversation. But those concerns have come forward. We're getting a lot of concerns from small business owners that this might constitute some huge burden on them, But you look at our baseline salaries, they are very insulting. His Excellency was forced to acknowledge that and think we have to start a journey towards a living wage. This is minimum wage.
In fact, that's what I wanted to ask. What necessitated the increments from 800 to 1,200?
Well, the president was very convinced that, what we are paying right now is very, very small. But it's a product of long years of neglect by successive administration and probably the size of the economy. Right? You can't give what you don't have, right? So it's hoped that once the economy booms and begins to do better, we'll go towards a living wage. This is a minimum wage. But let me strike this word of caution. In the law, it's provided that those who could still do better. There's a better provision condition in the law. So if AYV can pay better, you don't have to pay people basic minimum wage, right? You could quadruple it, you could quintuple it. You could take it to any level, right?
In today's economy, Mr. Minister, 1,200, is it truly a living wage where we sit now?
Nobody has called it a living wage. We call it minimum wage. The living wage is an aspiration for the future. I really hope this economy will boom, will discover oil or some real big miracle happens here so that we're able to pay people a living wage.
Your ministry is also involved with young people a lot. We talk about providing employment, providing work. What concrete steps have you taken as the minister, beyond policy adjustment and announcement, beyond shaping the ministry to ensure that young people have jobs?
Well, so even with this digitalization and what have you, we created jobs, right? We created jobs for that. So when you make it look like the ministry has to do the jobs, every contract we sign in cabinet, be it with Marampa, with Leon Rock, with Sierra Leone, CTC, whichever contract we sign, there are job provisions there. So we insist that we follow up on those numbers. At the last cabinet, His Excellency was very concerned that these people come, we'll give them gratuitous incentives on the promise that they will create 5,000 jobs, 10,000 jobs. We have to follow those numbers. I've been working with the majority leader in Parliament, Honorable Martin Numa, for us to track all of those contracts and follow those numbers. Right? So a lot is happening in that space. And now that we are mobile, we should be able to do a lot more than before.
There's also the issue of social security. For government jobs. Well, I can say there is that guarantee that at the end of the day, if you retire or you resign or you die, there's something waiting for you. But also NASIT has stated that they want to go informal. How is this going to be done, Mr. Minister? And you also have private institutions that are not even, living up to their NASIT obligations. From where I sit, I think and I see that the work is too much, in terms of reaching out to ensure that everyone who is in employment is secured at the end of the day. How are you going?
You're watching AYV Television.
And by the way, it's not only government employees that look forward to receiving NACIT when they leave. Even private sector employers, the law is very clear. Any person who has an employer-employee relationship should subscribe to NACIT. And the private sector has a large membership. Every one of them should be a member as long as there's a relationship, whether maybe it's contractual or not. Some people say, hey, this person is not a permanent employee, is on contract. You should pay. There's an obligation you pay, even on behalf of contractors. So having said that, we realize that the vast majority of our people live in the informal sector. That's where they find a living. Yeah, that's where they toil and drudge. So what are we doing? NACIT has been leading extension of social security to the informal sector. We have gone very far. A couple of months ago, I took the paper to Cabinet. Cabinet has approved it. The law is now being drafted by Law Officers Department. Seed money has also been approved for the social security scheme for the informal sector to be set up. We believe that is the right and proper thing to do because His Excellency President Julius Maada Bio is a human capital development person. He's insisted by all means necessary we have to reduce vulnerability and enhance the resilience of our people, particularly in challenging times. Like he mentioned, during COVID, when the rest of the country was locked up, you and I still got salaries. But those who had to, who lived by the day were in difficult circumstances until government came in with direct cash transfers and other palliatives, especially to address issues around stomach infrastructure. Yeah.
And that's what I wanted to ask. The reforms you're doing now within the ministry, how will they reach, let's say, the ordinary bike rider or the petty trader or the woman in the street?
Those are the real target beneficiaries. We have been engaging the leadership of those various groups. I will put boots on the ground. A lot of campaigns are ongoing right now who intend to intensify that in coming days and months. But they themselves are very convinced this is the right and proper thing to do. It's good to save for a rainy day, and they can't wait for the commencement of this scheme. So I'm also running a race against time. His Excellency has given me clear marching orders, clear timelines, which I will not disclose now, but I'm working clearly towards it.
On the issue of social security, do we have data to speak to those that are currently covered, under NACIT?
Yes, so I know we have about 9% of the population, the working population covered. So the rest of the Sierra Leonean public are uncovered. Not good enough, right?
Yes. And with these transformations happening, how would you want to capture those not covered currently? Because just covering 9%, Mr. Minister, it's not a good work done.
But I said it here. No, that's for the formal sector.
Yeah, the formal sector.
Majority of our people live in the informal sector. So that is why we want to extend coverage to them ASAP, for which I've been giving clear timelines and for which a bill has gone through Cabinet and it's awaiting next steps for enactment and subsequent rollout.
Again,
we are a 60-year. We are more than 60 years as a country, right?
Yeah, 65.
65 years old. Yeah, in the next few weeks. So nobody has ever dreamt that. His Excellency's government has. So let's give credit for the very conception of the idea and the practical steps being taken towards it. It was another SFP government that brought NACIT in 2001. Anytime we are here, we don't only care about people when they are working, we also care about them even when they retire. And not only those in formal employment, but also those in the informal sector. Because that's where the majority of our people live. We cannot abandon them and think everything is well. No.
There were also issues around, Sierra Leoneans be taken for employment in other countries. That falls under your ministry.
Yes,
how have you tackled that?
Well, so there is a labor migration law 2023. That law puts in place cardinal provisions how you manage the whole process of recruitment. First, it gives us powers to license private recruitment agencies that fulfill particular conditions. Yeah. Once they do that, you issue them a license. They are also bound by provisions in the law. They have do's and don'ts. So those are the ones we deal with. Many have deployed Sierra Leonean personnel in the Middle East in a safe legal and dignified manner, because that's the essence of the law, to ensure that migration is not only orderly, but it's safe, legal, and dignified. That's the difference between the migration that we supervise and tempo run. Tempo run is by all means necessary. You don't go through formal processes. So when we deploy our people, we do so in consonance with our diplomatic representations abroad. In the first place, once a recruitment agency tells us we have a job offer in Qatar, you send that to us, we write to the Ministry of Foreign Affairs and TOCO, right? They do the due diligence using, their footprints abroad, and they advise us whether it's a legal or legitimate thing to enter into. That's how we do it. So it reduces the risk of getting into any stupid agreements. Yeah.
Let's look at the comments on Facebook as we try to round off. Tondona is asking, what are the penalties to companies and individuals who avoid the legal system to obtain residential and work permit in Sierra Leone? And how is the ministry effectively monitoring work permit at local levels? Because there are lots of foreign workers in Sierra Leone, especially in the provinces, who are not with work permit.
Yeah, so that's a pertinent question. I actually spoke to it. I did say, for those that avoid the straight and narrow path, come in, register on NCRA, obtain resident permit, then you obtain the work permit. You are found working illegally, you have a personal fine of $5,000, and whoever employs you, or whoever you work for, also pay another fine of $5,000, right? Yeah, so that's very clear. We realize many people are working in the provinces without work permits. In fact, the whole concept of work permit for many is alien, right? So we have to scale up outreach and awareness raising, and of course, that is going to be closely tied down to compliance enforcement, right? So that's why we have recruited people. Again, like I said, His Excellency gave me authorization to recruit 150 people. Yeah, they say that is the first that has happened in 15 years, the staff and the ministry. So it was completely abandoned. When I told my staff I'm going to address these things, they felt it was a joke. The same way when Kennedy said he was going to land men on Mars, on the moon, people felt it was a joke. But they see it unraveling now. So this morning we are talking about inducting all those employees in the next coming days.
Are there future policies that you would love to implement or that are in the pipeline? A lot. You know, this ministry is a beehive of activities. There are many things begging for attention. For example, previous and recent experience has taught us that we need to do more to preserve end-of-service benefits for employees. I worked at the airport, and I know that the Sierra National Airlines folded up without paying end-of-service benefits to many people. Many of those employees died without end-of-service benefits. Yeah, Cabinet has had to handle Sierra Leone Airports Authority. They also did not have money to pay end-of-service benefits, right? So we have had to find ways to accommodate them. Theirs have now been paid, you know, thanks to His Excellency's intervention. We also have Sierra Tel. We're struggling with that right now to pay the end of service and other benefits. So the place is replete with examples of those, right? So we now want to ensure that the Employment Act makes provision for this. Every employer must set up an independent and private and separate end of service benefit account. Yeah, this is to ensure that we separate end of service accounts from operating capital. Because many, when you want to retire, they look at what they have now, yeah, from their operating capital and pay. Sometimes when they go broke, if they are foreign companies, they leave the country unceremoniously. If they are Sierra Leonean companies, they don't have assets. What can you do? All your years of service go up into flames without any recompense for that. Yeah. So we are setting that up. We are already working. Last week, we had a workshop with our tripartite partners, employers, and organized labor. So first thing, we'll insist that every employer, accrue. Well, we want to know what they have accrued over the years in respect of your previous services here at AYV. How many years have you worked for? I think 7 now.
7 years. So we want the management to now say, look, he's worked for 7 years. This is what he should have earned, and begin to put that into this secluded account.
Would that be legislated for, or are you leaving
It's already legislated in the Employment Act. It's just operationalizing it. So we're operationalizing that. They can now set up benefit trusts. Yeah, they can say, okay, AYV will put in this account. If they want, they can appoint a management committee to look after it. Yeah, if they want, they can even ask people to invest it so that there are returns. Yeah, we don't want to leave it to the whims and caprices of employers. Because, we had a situation in Koidu, right? Yes, if they were paying. So one of the first reforms is, I don't want people to wait till they work for a farm for 100 years before they get end of service benefit. If you want, every year, you can get what you have earned, whatever is accrued for you for that year. Up to a maximum of 5 years. We cannot keep beyond 5 years. Your employer is not your banker. You can receive your money, go invest it elsewhere. So we have started consultations. We had a workshop and a consultative meeting with employers, our tripartite partners, and organized labor. So this is an ongoing discussion. This is going to be big. It's going to be huge. I have seen even companies that will consider going concerns. Yeah, if you ask them to do that now, they will not be able to pay. Because it's up for them. Everything is part of their operating capital. We now want this to be set aside so that, should you decide to go on today, those employees will still be paid. Government has had to bear the brunt of paying end of service benefits for many people whose employers either became insolvent or they fled. You remember Comio? Yes. So we have a replete of examples around here. So that's one thing. Of course, we're doing the occupational safety and health bill. That's in Parliament now. I'm going to find time now to sit with them so that we can begin to pilot that. The one we have currently regulating occupational health and safety is I think it's the Factories Act of 1974. Yeah? See how old that is, eh? It's only 3 years older than me. Yes. So, but I have a reputation of repealing every kind of law, especially those older than me. So this is supposed to be light. But it's very important. It talks about occupational health and safety, the responsibilities of employers, the responsibilities of employees, the representatives of members of the public, the representatives of government. Every party has a role in this bill, once enacted. It's also, of course, it's closely tied down to the workers' compensation bill. So in case of a workplace accident, there is some disability, it's clearly the workers' compensation talks about how you calculate disability to ensure that the person gets they are just desserts, right? Because as it is now, even if there's a fatality, the calculation is so insulting, so small.
It's entirely left to the court system to decide. That if it is taken to court self in the first place,
you might not win anything. You might stay there forever. You come to us, the provisions of the law are not good enough because they are as old as 1974. We want to change that, right? We will work very hard to ensure that we get zero LTIF, the workplace accident. But in case we do, those persons involved or their families should be adequately compensated. So that's why we're enacting those laws.
You've described your leadership as truly transformative. At the end of your tenure, what single statistical improvement do you wish to leave with the workers at the Ministry of Works or with the people of Sierra Leone?
Well, I'm no stranger to the people of Sierra Leone. They've seen me work in information for 5 years. They know I transformed an otherwise talking ministry to much more. You are yourself a witness. I repealed the criminal libel law. Journalists have come to this ministry. They did their best, but they could not repeal. I did, with His Excellency's support, unflinching support, and relentless trust in me. We were able to do that. You remember that? Yes. Apart from that, of course, the regular, that was almost routine. I inherited a blacklisted ministry. The World Bank had abandoned the ministry. It was blacklisted. We brought them back, through hard work. I left $50 million in that ministry for various things. We started discussions about landing a second cable. And I brought in money for journalists. Remember, we enacted the Cybersecurity and Crime Bill. Without that, they could not have tried the November 26 coup plotters. Yeah. So I have been about action. The footprints are there. I don't want to talk about it. In this new ministry, you have heard me give testimony. And it's, come to May Day this year, we're going to have a testimony moment where people from far-flung communities, workers, all over the place, will be there to tell you how we have touched their lives under my leadership. Yeah, the things we have done, the interventions we have done that have made life better for them. Their workplace more enabling, and more, they're enjoying the benefits of decent work. So there are many things we're doing. For the jobs, are just by, as at this day, this is not quite updated. As at the end of December 2024, we have had about 69,202 jobs created. Let me say this. When we talk about job creation, again, if you've read the manifesto and the medium-term national development plan, His Excellency did commit to creating 500,000 jobs in the next 5 years, right? Of that 500,000 jobs, we have had, at the end of 2024, been able to record 169,202 jobs. These jobs include short-term jobs, permanent jobs, and other kinds of jobs.
In what sectors, Mr. Minister?
Principally across agriculture, NACSA, Statistics Sierra Leone, and several others, mining. These are recorded, right? They are not my thoughts. So if we add this, I know we have gone past. If we add this was at the end of 2024. My team is not able to update me beyond this, but I'm sure we did very well in 2025 too. Yeah, so we are making progress. Yes.
And finally, as we round off, Mr. Minister, policies sound good on paper, but Sierra Leoneans are asking a simple question. At the end of your tenure, will the living condition of Sierra Leoneans who are employed or unemployed improve?
Well, that is to assume that this minister that sits here is too powerful to be able. If I had a magic wand, I would have just sung it and, like in the Bible, let there be light and there was light. I would have done that long ago. In fact, before me, His Excellency would have done it at the start of his first term. But there are a whole lot of variables that come to making that decision. When I spoke, I told you that we want to move towards a living wage. That's aspirational. We might discover oil today. We might have a big minerals boom like we had here in 2011 or thereabouts, right? If we have all of those, why not? We are a human capital development government. We think our people are the very best resources we have. That is why we put them at the heart and center of everything we do. Yes, we do. So if I have the opportunity, I would like to be remembered for that. But let us remember the small steps. That is what crystallizes into the big step. I mean, we're at 800. We are now jumping up to 1,200. You never know.
And for those who are currently captured under this employment, will their jobs be secured?
Well, job security is a major global discussion right now. The world is in flux. Things are changing fast and furiously. So let us continue to pray that every job is secure. But I can't sit here and guarantee that, because there are also exogenous factors, there are homegrown challenges, and all of it. So let us pray that the cloud recedes today and will return to silver lining, so that we can continue to make progress. But these are challenging times. Right. Government is doing her very best in the circumstance, and will continue to do so, because that's our responsibility.
All right, thank you very much for joining us this morning.
Thank you very much, quite a pleasure.
All right, he's Mohamed Rahman Swaray, the Minister of Works. He joined us this morning here on AYV. I think I've just been communicated to. We do not have enough time again, but I'd like to say many thanks to our viewers and listeners for joining us this morning in the program. We say many thanks to our sponsor, Local Commercial Bank, and other advertisers for sponsoring this show. Until we meet again tomorrow for another exciting topic here on AYV, I've been your host, Bokari Matia. Do take care of yourself.